Hello everyone, my name is Rafael Aponte. I'm a medical doctor from the Center for Research and Training in Neurosurgery, CIEN, from Bogota, Colombia. Today I'm going to introduce you the entitled abstract, Survival Prognostic Factors in Patients Treated Surgically for Supratentorial Metastases in a Latin American country, a series of 28 cases. Brain metastases result in a neurological deficit, seizures, paralysis, and cognitive decline, increasing human and financial costs. In patients with cancer, the proportion of patients suffering from brain metastases ranges from 9 to 50%. The aim of this study is to describe different variables in our sample of patients that underwent surgical treatment for supratentorial brain metastases and identify variables related with better outcome in Hispanic population of a Latin American country. We made a retrospective review of 28 patients without previous brain metastasis surgical treatment that were treated with surgical resection in our hospital. Demographic, clinical, and therapeutic variables were controlled. Categorical variables are presented as proportions and numerical variables as means or medians. The odds ratio was controlled according to 6-month survival among variables. On our sample, 19 patients were younger than 65 years old. 15 were female. 17 had adjuvant radiotherapy as complementary treatment. 19 had a Karnofsky performance score higher than 70 points, and 8 patients had a synchronic diagnosis. Some of the patients that didn't have adjuvant radiotherapy was because of health insurance issues. Among the clinical variables, we could see that 16 patients had the brain metastasis on the frontal lobe. Only 3 patients had 2 or more metastases. The most frequent primary cancers were lung, breast, and renal cancer. On our results, we first controlled the variables with the survival mean. And we can say that patients that were younger than 65 years old that received adjuvant radiotherapy had a Karnofsky score superior than 70 points, had a synchronous diagnosis, or had a metastasis located in the frontal lobe, had a higher survival mean in months. Then we controlled the survival with a cut of 6 months and made an odds ratio calculation. And among all the variables, we only had one statistically significant result, that was for frontal lobe, or lobe location of the metastasis. For the rest of the variables controlled, the p-value was not statistically significant, as you can see. The variables of better outcome on our study are related with the variables of better outcome we can find in the literature. These variables are a Karnofsky score higher than 70 points, young age, or a synchronous diagnosis. However, we found an interesting new variable, the location of metastasis. On our literature research, we did not find any specific paper that was studying the lobe location of metastasis and a better prognostic factor. The only information we have, or we know, is that supratentorial metastasis had a better outcome of survival than infratentorial metastasis. This is why we can conclude that we need further studies with higher statistical significance on the Hispanic population in Latin America to assess prognostic factors. And also, we know that in our media, despite the no benefit of combined surgical and radiotherapy treatment, health insurance issues hampering the access of the complementary treatment, possibly causing an impact on survival. Those are our references. Please enjoy the 2021 IWBNC, and thank you for watching.